to today's video. Today we are going to be talking about one of the lesser talked about pregnancy symptoms. Today we're talking about piles, otherwise known as hemorrhoids, why they come, what causes of them, and what sort of symptoms might you be experiencing if you in fact have got them during your pregnancy, and what we can do to both reduce them and avoid getting them in the first place. Let me know if this video has been helpful. Do hit the subscribe button if you haven't already, and let's dive straight into what exactly piles or hemorrhoids are and what we can do to avoid. So let's look at what exactly hemorrhoids are. And during pregnancy, what happens is we have not only the extra blood volume, but also we have much more flow of certain hormones. So in particular, we're talking about relaxin and progesterone, and the impact that these have on our body is super important because they do so many important things like softening and relaxing of our ligaments, of our muscles, and included in this is our veins. So what happens, particularly with the extra blood flow that we have on board, almost up to 1 more litre during pregnancy, and never mind all of the other extra fluids that we're carrying, and baby and placenta and amniotic fluid, is with that softening and that relaxation, that vasodilation that happens, we oftentimes get more of a flow into the veins, but due to the pressure of baby's head, we're not getting the same flow out. So if you are one of those unlucky people to be experiencing this vasodilation at the back passage, where we have piles or hemorrhoids, you might be experiencing symptoms like itching, pain, just general discomfort, and maybe even a little bit of bleeding. So let's dive into what the things that we can do that initially can prevent them from occurring. So I'm going to start by saying a little bit around air quotes around the word prevention, because for some really unlucky women, regardless of all of the preventative tips and things that they implement during their daily lives, they go on to still have hemorrhoids. And I do also feel like there's some sort of genetic component there as well. So bearing that in mind, the first thing that we want to be talking about doing is looking at our fibre intake. And this is something that I think people will kind of go, oh yeah, obviously, like, we're going to be increasing our fibre. Or they'll be thinking, that's absolutely bananas, Kitty. How can I possibly be eating more fibre in my diet when I've got nausea 24/7 and all I'm craving is like white bread, starchy carbs, and things like that? So I suppose I'm talking about doing what you can, whatever you can manage. So you're thinking about fruits with the skin on, you're thinking about cruciferous veggies, you're thinking about, broccoli, cauliflower, and brassicas like cabbage, things like that, that you can incorporate in your daily diet. If you're finding it particularly difficult to stomach fruits and veggies, you can blend them into a smoothie. You're still getting all of the fibre that way. But the idea with the fibre is it helps to move things along the bowel, and it means that when it comes to excreting your waste products, that you're not putting the bowel under as much strain and as much pressure. So tip number 1 is to increase your fibre intake. And then tip number 2 is kind of going in hand with tip number 1, which is to increase your water intake alongside your fibre intake. So of course, when we think about that undigestible fibre, so things that are present in, whole grains, seeds, that sort of thing, what we're looking at there is the indigestible fibre or insoluble fibre that carries through our bowel, through our digestive system. And of course, that needs to bind to something to move through your bowel. So we're talking about water. So making sure that you are drinking enough water as the day goes on to carry that insoluble fibre through our bowels and make for an easier poop situation. If you're having difficulty getting enough fibre in your diet, you can go ahead and take a psyllium husk supplement, which is like a tablespoon or so of the husks of the flax seed, essentially. And you can just stir those in a little bit of water and chug that, and that will really do the trick. So tip number 3 kind of goes hand in hand with those first two, and that is where we're talking about things that can ease the journey of defecation. So having a poop, we want it to make it smooth, we want it to make it as easy as possible, and with that, we want to, the whole goal is to avoid straining. So when we're straining, when we're pushing like that on the toilet, what we're doing is we're increasing the pressure down below. So what we want to be doing instead is looking at different practices that we can do. Things like bringing in a poop stool is what we call it, or squatty potty, something that's going to make sure that your knees are up, so we're creating that nice straight line. We're going to be looking at what sort of breath that we can do to soften everything down below. So we're talking about the same sounds that we'd make when we are actually pushing our baby out, so soft like ahs and whoos and has, and things that we're going to be doing to release and soften the pelvic floor. So soft face, soft jaw, soft pelvic floor, to encourage things to move through nice and swiftly. It's also really helpful to use to maximize the time when our body would naturally have the urge to go to the toilet. So if you're feeling the urge early morning and you're putting it off, we know it makes it that little bit more difficult later on in the day. So typically what would happen in a healthy body is that approximately half an hour after your first meal, you'll feel the urge to go. So if you can maximize that opportunity and sort of nugget that time in your day so that you know that you're close to a bathroom, you've got your poop stool to hand and maybe a good book, so that you can make sure that you are ready to utilize that time wisely. And this might be a little bit of a TMI for some, but if you do find that you're in a spot of bother and you feel like you've been doing all of these other things and you're actually very bunged up, very constipated, it would be worthwhile considering both a manual evacuation is what we call it in nursing, where you are either inserting a finger into the anus yourself and relieving whatever fecal matter is stuck, or as a woman you can actually insert a clean, maybe there's toilet roll around it, or a gloved finger inside the vaginal wall and place some pressure along the back of the wall to help whatever might be stuck. So that's a little pro tip from my nursing days that might be helpful for you if you're stuck in that position, quite literally stuck. Let me know maybe if I should do a whole separate video on constipation in pregnancy. That might be worthwhile looking at. So following on from that then, if you do find that you are constipated in pregnancy, we want to be looking at some laxative options. It might be worthwhile taking a small amount of something every single day. So for instance, you can take more natural things like maybe a gentle senna tea, which is a herbal remedy, or you might be looking at maybe having a half a glass of prune juice or a little prune compote in with your porridge every day. Looking at these sorts of things to help things move along really gently and smoothly can really make a difference to the impact that it can have on your hemorrhoids, particularly if you're already experiencing them. It can really reduce the symptoms. My next tip then is directly related to hemorrhoids if you already have them, and that is to avoid standing for long periods of time. The weight of the gravid uterus over that pelvic floor region can really put a lot of pressure on an area that is already maybe struggling with the extra weight of the gravid uterus and pregnancy in general. So we want to avoid gravity working in our favor in that way, and we want to be thinking about putting our feet up every so often. We want to be encouraging the blood flow back up through the system, so doing some calf pumps, maybe circling your feet if you're at a desk for a long period of time, considering wearing things like TED stockings where they are like compression socks if you're working long shifts, and seeing whether you can find opportunities during the day to actually just elevate your feet and take a break altogether. Okay, so now that I've given you some of the ideas that you can use for prevention, let's dive into the treatment and how we can help you feel a little bit more comfortable if you are one of the unlucky ones already experiencing hemorrhoids in your pregnancy. Okay, so my first tip would be to talk to your doctor, whether it is your obstetrician or your GP if they are very knowledgeable. There are 3 different options that can be really helpful in terms of relieving your discomfort. The first would be a gel or an ointment. So we're thinking about something like Chiroproct or Anusol, which can also have some numbing ingredients that can really work very nicely for the discomfort, but also added ingredients like a steroid to reduce the size, and can have a lovely cooling effect that can make it much more comfortable. As well as that, you can ask for a Chiroproct pessary, which you insert up inside, and again has that lovely impact of both numbing but reduce, as well as the steroid working to reduce the size of the hemorrhoid itself. So Anusol, Chiroproct, ointment or pessary. The next option would be to either with a clean hand and short nails, or maybe in the bath if you feel more comfortable, that you can actually just pop them back inside and push them back inside if that's something that you feel comfortable doing. But equally, if you're uncomfortable doing something like that, you can ask your care provider to do it for you. The next thing that we can think about is how can we cool down the inflammation and the swelling that is happening there with that vasodilation. So with anything where there's some degree of inflammation, we're talking about something cool to bring it down. So you might go ahead and use a cool cloth, maybe an ice pack, or maybe you'll go ahead and make some padsicles where you just get a normal pad and you will drench it in a combination of maybe witch hazel, some aloe vera, pop it into the freezer for an hour or two, and then pop those directly on the bottom to help really just cool and soothe that area. My last tip here relates to cleanliness and hygiene around minding those hemorrhoids and minding your bottom area. So the first thing would be to say try a nice warm bath. Nothing in particular needs to be added, but it can have a lovely soothing effect on the whole area. With regards to cleanliness, we're talking about keeping the area both clean but also dry. And that can be really quite tricky if you've got a very tender, sore bottom. So making sure that you have things on hand like a squeezy peri bottle to maybe wash down the area with some warm water after going to the toilet, and then patting dry. You can also consider using maybe some baby wipes to be for a more gentle clean and then just patting dry afterwards, or popping on a little panty liner to make sure that it's wicking away any of the moisture that might be in the area to make sure that it sort of avoids any further friction or any more soreness. Now let's dive into what we can do to help them fully resolve, or do they fully resolve? Okay, so the big question is, Kitty, do they go away? And the good news is that for the majority of women, once your pregnancy is over, your baby is here, and those relaxin and progesterone hormones kind of dwindle away, majority of women will experience them just disappearing, or you can help them with a little bit of pressure just to pop them back inside. And for a majority of women, that is the case. However, for some women, they simply don't go away on their own. And for those of you who are those unlucky ones, what I would say is make sure and talk to your obstetrician and try and get a referral to a surgeon who will be able to give you a more definitive answer to your worries. And I hope you found this video helpful. Do let me know in the comments section down below if you have found this or any of the tips that I've included helpful for you, and if you have any further support that you might offer some of the other mamas who have been watching this video. I hope you found this helpful, and I will see you in the next video. Thank you so much for watching.